Ever wondered why one side of your face suddenly feels weak and paralyzed? Could it be something as enigmatic as Bell's palsy? Bell's palsy is often used to describe an acute peripheral facial nerve palsy of unknown cause. It frequently strikes in the third trimester of pregnancy or the first postpartum, or even in diabetes patients. However, it can affect any patient at any time. The exact cause of Bell's palsy is still a topic of debate, but a herpes simplex-mediated viral inflammatory mechanism has been proposed. Another common virus associated is the varicella zoster virus, as seen in Ramsay-Hunt syndrome. Even ischemia of the facial nerve has been implicated, especially in patients with diabetes. Typically, Bell's palsy presents with a rather abrupt onset of unilateral facial paralysis. This could include difficulty closing the eye, a drooping eyebrow, a mouth droop with loss of nasolabial fold, loss of taste sensation on the anterior two-thirds of the tongue, decreased tearing, and sharp hearing. Some patients even complain of discomfort behind or around the ear before these symptoms set in. A recent history of upper respiratory infection may also be present. In diagnosing Bell's palsy, it's crucial to differentiate between a peripheral and central lesion. Sparing of the forehead muscles suggests a central lesion due to bilateral cortical supply to the facial subnuclei innervating the forehead, as opposed to unilateral cortical supply to the facial subnucleus innervating the lower face. Not all patients with Bell's palsy require diagnostic studies. Those with a typical history and examination consistent with Bell's palsy may not need further studies initially. However, imaging should be considered if there is slow progression beyond 3 weeks, atypical clinical signs, or no improvement at 6 months. The physical imaging pursued is typically an MRI with and without gadolinium, and electrodiagnostic studies may also be considered. For patients with new-onset Bell's palsy, steroids can be a game changer. They should be offered to increase the probability of recovery of facial nerve function. The addition of antiviral agents does not significantly increase the probability of facial functional recovery, but a modest benefit cannot be entirely ruled out. Therefore, patients might be offered antivirals, particularly in severe cases of facial paralysis or those with possible zoster sign herpes. The prognosis of Bell's palsy largely depends on the severity of the lesion. In general, clinically incomplete lesions tend to recover better than complete lesions. The prognosis is favorable if some recovery is seen within the first 21 days of onset. In summary, Bell's palsy is an acute peripheral facial nerve palsy that could affect anyone, but is commonly seen in pregnant women, postpartum women, and diabetes patients. It may be caused by herpes simplex virus, varicella zoster virus, or facial nerve ischemia. Its symptoms include unilateral facial paralysis, and its diagnosis may involve an MRI or electrodiagnostic studies. Treatment often includes steroids and possibly antivirals, and the prognosis is generally favorable if recovery begins within the first 3 weeks.